So my name is Greg Garrett. I'm the Director of Food Policy at the Global Alliance for Improved Nutrition. That's a Swiss foundation, and we exist primarily to translate evidence to policy and practice in low and middle income countries. So we're very much focused, most of our programming in Africa and in Asia, where there's still a high burden of malnutrition as well as overnutrition, which is coming to the fore now. So what I'd like to do, the intention of this particular presentation, is to provide an overview of the status of both large-scale or industrial fortification, which has been around for over 100 years, adding fortificants at the processing stage, and then the much newer intervention of biofortification, conventionally breeding plants to enhance micronutrient content. Hidden hunger, we know, is affecting approximately 2 billion individuals. You can see that the majority of those individuals are in Africa and a few different countries in Asia. These include iron deficiency, iodine deficiency, vitamin A, as well as zinc. Those are the four primary ones. And the 1,000-day window from conception up to a child's second birthday is a very important period during which they really need to have the adequate amounts of nutrients in their diet. And also the preconception time, so women of reproductive age in general must ensure they're consuming the right amount of nutrients even before they conceive to ensure optimal development of the child. So some of the consequences, why is this important? Vitamin A deficiency, we know that there's some 400,000 children each year that are going blind due to severe vitamin A deficiency, but even moderate vitamin A deficiency will lead to a weaker immune system. Iron deficiency and iodine both lead to adverse effects on cognitive development. In the case of iodine, we're looking at losses of IQ points around 13. For iron, we're seeing some 82% of children in India can be iron deficient. So this also has an impact on the long term for economies because these are irreversible effects and will obviously have a very negative consequence on livelihoods and on people's income in the future. And zinc deficiency could be affecting up to 2 billion individuals around the world. Just an example of iodine deficiency. The good news on this, which I'll share in a moment, is that we're getting very, very close to being able to control iodine deficiency globally. I think that's very exciting. But here we see the iodine sufficient and the iodine insufficient brain in terms of the, just a visual picture to show you that you can even see the effects in the synapses and the development of the young brain. And salt iodization, even though unfortunately it's not practiced in the United Kingdom, has been a very, very successful intervention to ensure optimal iodine intakes. So a couple guiding principles for fortification, both biofortification as well as this addition of fortificant at the processing stage. And this has been published. This is based on programs that have rolled out in 80 countries now. We published this recently. So one, fortification should be part of a public health strategy if you have two conditions in place. One is your food supply is not providing the right amount of micronutrients in that supply. And secondly, there's a fortifiable vehicle. And even though that sounds really obvious, there have been many, many countries that have tried to roll out the fortification of a food when in fact there is no process through which you can fortify that food. And I can cite examples from India, for example, where 10% of the population might be receiving the fortified food at very low levels, but it's not sustainable. It's completely propped up by donor funds. So you need to have a vehicle that has had evidence through efficacy and effectiveness studies clearly, and also you need to have an industrial process in the case of large-scale food fortification, and in the case of biofortification, you need to have the registration of the seeds in that country. Secondly, fortification is complementary. It's complementary to a number of other interventions. It's not a panacea. I think at GAIN, we were founded by the Gates Foundation, and I think Gates and GAIN at the time, we were very, very excited in 2002 because we really felt that fortification could be a major solution for malnutrition. We still believe it's a pillar, but we're finding that you hit a ceiling at some point in terms of coverage. What is the penetration of fortified foods into a population? So it's not a panacea. It can be complementary to other evidence-based interventions. It's delivered through national food systems. It plays a major role in underpinning prevention of micronutrient deficiencies, including during the period of preconception in 1,000 days. Another interesting finding is that mandated government programs tend to reach vulnerable populations better than voluntary programming. And this is, I think, quite obvious. If you have a voluntary fortification program an industry rolls out, often that will reach the higher income populations. They will go out of their way to purchase those foods, but they are often not the ones who are most at risk or at needing the micronutrients. So if the government mandates it, it levels the playing field among the entire industry, and you tend to get better coverage even among at-risk populations. Going back to this principle of it not being a panacea, the goal of both biofortification and industrial fortification is to shift the distribution of intakes so that the majority of the population has an optimal level of intake of these micronutrients. You're not going to reach all segments, including the most rural or the most at risk, and you wouldn't want to necessarily because there will be other sources in the diet of nutrients and you could end up with toxic levels. So you're looking to really shift the distribution of intakes among the general population. So why focus on staples? Well, there's the obvious reason that this is what people are consuming. But if you look at the trends between 1965 and 1999, you can see that while the world population was booming, the consumption of cereal grains, in particular in India, Pakistan, Bangladesh, but also in the developing world or low and middle income countries in general, was skyrocketing. In some cases, they're eating 2 times as much or as many cereal grains as they did in 1965. So it is an avenue through which we can reach people. The economics make sense as well. If we consider the cost benefit of adding iron to foods, you're looking at a cost benefit of about 9 to 1. That is, for every dollar you spend on an iron EDTA or an iron sulfate or an iron biofortified food, the $9 that would have been spent or would have been lost, you could say, through adverse outcomes is prevented. For saltization, it's 30 to 1. Okay, a couple maps. So the status of grain fortification, that is maize flour, wheat flour, and rice, is that 88 countries have now mandated it. There's a number in Africa where I believe quite strongly they should be enacting legislation. And you can see those gray countries do not have it. Here in the UK, there is some flour that's being mandated with iron. In terms of mandating oil, edible oil, sunflower, palm, ghee, which is used in South Asia, or fats and margarines, retinol palmitate, which is a synthetic vitamin A, is being added in these countries, 30 countries now. So that's preventing vitamin A deficiency. And iodization, over 140 countries have now implemented saltization. We'll get to a slide which shows that the tremendous impact this has had. But I think we're at a very, very interesting stage where we could say that we're close to controlling iodine deficiency disorders. Biofortified crops, you can see that 30 countries have now released these, and it's in testing in another 25. Some of the major crops that have been conventionally bred to enhance the nutrient content includes rice, wheat, maize, orange sweet potato, cassava, lentils, beans. So again, a focus on staples, what people are consuming today. You probably cannot see that map, but I guess these presentations will be made available, and this is also on Harvest Plus's website, but it gives you the detail of where each of these crops have been released throughout Africa, Asia, and South America. And we've seen a real trajectory in terms of the release of these crops. So you can see it's just a nice curve going up, and there's a lot of new research around new enhanced varieties that are coming out in the coming years. And there's a number of donors, including DFID, which have been investing in the research as well as the scale-up of this intervention. Okay, impact. I'd like to just share, you've seen the maps, but is it actually having an effect? So I'll go through each of the micronutrients in terms of both large-scale mass fortification as well as biofortification. So iodine, arguably the most exciting that we have. Back in 1990, 113 countries were iodine insufficient. Children were having adverse outcomes in terms of education. IQ points were lost. We go forward to 2007 down to 47, 2015, 25 countries. The last count, which was in 2017, done by the Iodine Global Network, showed that we're down to only 19 countries that at a population level, in aggregate, we're looking at 19 that have iodine insufficiency. Incidentally, if I may, the UK in 2010, I see some nods, the Lancet showed that there is moderate iodine deficiency in the United Kingdom. And I think my view of the situation is that while it would be great if people would consume more natural iodine in their diet, including from kelp or from seafood, that's not happening quick enough, so salt would provide an option. And you can have salt reduction efforts alongside salt iodization. You just increase the level of iodine as you decrease your salt intake. So the two public health strategies are absolutely compatible, and the World Health Organization has come out and said so. Folic acid, so this is a synthetic folate that's being added to grains. In every case, you can see that there's been a reduction, an actual impact on folate preventable neural tube defects, a type of birth defect. And we're very excited by this intervention because there's a lot of countries that have still not mandated it, and yet we could do so much more to prevent birth defects. Iron fortification is a little bit more complicated. In terms of a good program with adding a bioavailable fortificant, iron EDTA or an iron sulfate, you would see a reduction of 2.4% in the deficiency in a country. But over time that would accumulate and you would have great gains like we've seen in Costa Rica or in Egypt in the past. But there's a lot of confounding factors with iron, including inflammation and malaria. And so if you really want to completely eliminate iron deficiency, you need to look at a few different interventions along with iron fortification. Vitamin A, this is just, we haven't done any meta-analyses, unfortunately, on vitamin A impact, vitamin A fortification impact, but this study we did in Indonesia showed that through the addition of retinol palmitate to edible oils in West Java, among all population groups, the deficiency rate went from 6% down to just less than 1%. Okay, in terms of biofortified foods, so that was industrially processed. Orange sweet potato, vitamin A, orange sweet potato, has been released in Mozambique and Uganda, other places as well, but I'll use these two examples. 24,000 households in Mozambique and Uganda from 2007 to 2009. Findings have showed a high rate of adoption and consumption among those households. In Uganda, 250,000 households have now been reached with orange sweet potato in Uganda. What's been the impact? Well, I find it fascinating that women, for example, are receiving, when they consume this food, their full recommended nutrient intake of vitamin A, which could be around 1,200 micrograms. So highly impactful, and there's been further studies that have actually showed what that has done for health outcomes. Okay, so what I think is missing, though, to bring these two interventions together is data that shows the coverage and the complementarity between the two. We have coverage data on large-scale fortified foods. We don't have data yet on the coverage of biofortified foods. So what we're doing is we've come up with a fortification assessment coverage tool which measures the household consumption of these foods against the intersection of vulnerability. So rural, women of reproductive age, poor, non-poor. We're expanding that now to include biofortification. And what we'll be able to do is add a fourth column here. This is just on industrially processed foods. So vitamin A added to oil, 98% of the population in Kano, Nigeria, where this coverage survey took place, consumed the food. However, only 36% consume it through a processing, through an industrial process. That means the rest are getting it through a local oil press, and that's arguably not a sustainable way to fortify. Wheat flour, 83% of wheat flour of the population consumes wheat flour, 83% consume fortifiable wheat flour. However, that pink is the consumes fortified food. So what percent of the population is consuming that food with fortificant added? We'd like to add biofortification to this so that we can start to see who consumes what and the complementarities between the two interventions. And our vision, of course, is that that orange bar, which is fortifiable, is matched by the pink bar, if you can call that pink, I'm not quite sure, which is consumed fortified foods. They should match. If it's mandated, all packaged industrially processed foods should have fortificant in them. So there's a big issue with enforcement here, is what you're seeing. Okay, so 18 of these surveys have been done in 16 different countries. We've just launched a website which you can go to. It's www.fortificationdata.org. Currently, it only has data related to industrially fortified foods, but there is a plan to put in biofortified foods as well. This will tell you where they're released, the standards in each country, the level of fortificate that needs to be added to the foods, the types of foods, quality data, coverage data. Okay, just to say there's a big unfinished agenda here, as you could imagine. Even though 88 countries have mandated fortification, there's a lot that needs to be done to start new programs, but to also improve existing ones and measure others. So 5 sets of activities to make the future fortified. 1, let's advocate to build and expand new programs where there's a need. 2, let's provide technical assistance and political changes to improve the compliance. That's really speaking to the enforcement. 3, we need to monitor better, research, and evaluate. Only 16 countries out of 88 have meaningful coverage data. New innovations, for example, rice is really rolling out now, double fortified salt. Tea is being looked at. So there's new innovations. And also we need to scale up biofortification. Harvest Plus, our partner, has a vision to ensure 1 billion individuals by 2030 are consuming biofortified foods. And I wanted to just close with a quote from arguably the father or one of the fathers of agriculture, Sir Albert Howard. And I just thought it was very relevant to today. He says that related subjects such as agriculture, food, nutrition, and health have become split up into different self-contained little units, each in the hands of some group of specialists. These experts suddenly find themselves learning more and more about less and less. And the remedy, of course, is to look at the whole field, covered by crop production, animal husbandry, food, nutrition, and health as one related topic. So thank you for the opportunity.